So a 10-point plan was developed for what we're going to do in the next pandemic. The first step is really accelerate vaccinations because that's our key to get back to normals, to get immunity to the virus or to the pathogen, and also really work on global equity of those vaccines because it should be distributed everywhere, not just in high-income countries. The second step is if you have the vaccines, that's when you tell the world that life can go back to normal. Ease restrictions, don't need mask mandates after vaccines because you're really giving all that optimism about the vaccine so that people think, oh, that unlocks the key to normal life. The third is really emphasizing harm reduction approaches, not doing things that actually are causing harm in society, like closing other aspects of medical care because we need that heart health, the stroke health, everything else, but thinking about more education, telling people why you'd want them to mask, as opposed to a more dictatorial, coercive approach. And then the next is really encouraging outdoor activities. This for any respiratory pathogen, outside is the best place to be. We closed beaches and parks in some places, but that's exactly where you want people to be because it's so much safer with the ventilation to be outside than in closed indoor spaces. And then the fifth goal is schools really need to be considered carefully, especially if children are less at risk. We want to reopen our schools as quickly as possible because we've seen through this pandemic how important schools are for children's mental health and their learning. The sixth step is to, first, you may need to lock down if there are hospital overflowing or it's really severe. But after that, figure out how to keep people safe with masking, ventilation, distancing, but don't do the massive kind of blunt lockdowns. Think in a tailored way. May close restaurants, but schools are really important. So be more incisive and chisel-like in your approach as opposed to blunt approaches. The next step, which is number 7, is to de-emphasize anything that isn't working. We figured out pretty early on that you don't need deep cleaning of schools, for example, and close the schools for a full day and do deep cleaning because it's not fomite spread. This is a respiratory spread pathogen. If deep cleaning doesn't work, stop doing it because that will decrease trust in public health to keep a theater going of things, of prevention measures that are ineffective. And then the 8th step is really reassessing testing after vaccines. We used to test everyone prior to vaccines, but after vaccines, it's really people who need antivirals. That's who you want to test so that you say, okay, you need a Paxlovid right now. So it's really, when you have your tools, you don't need to test as much. The 9th step is expanding those antivirals. Treatments are very important for any virus that you can't eradicate, because if you could eradicate it, you wouldn't need treatments. But we do need treatments ongoing for diseases we can't eradicate. And then the last step is rebuilding our trust, preparing for future pandemics. That is the step that we're in right now. We got to rebuild our trust in public health. In March of 2023, show that we have about a 30% trust in the CDC and the NIH right now. That's not a good place to be for the next pandemic. We want to say what worked, what didn't work, common sense approaches, moderate, reasonable approaches so that we can rebuild back that trust. So this 10-point plan is really outlined in the last chapter of my book, which is called Endemic, a post-pandemic playbook. And it's available wherever you buy books, Amazon, Barnes & Noble, bookstores, coming out July 11th, 2023.